The following is an explanation of the health plan for the employees of Alabama Climate Control for July 1st, 2018 through July 1st, 2019. My name is Barry Hamrick. You can reach me anytime at 205-222-9440 or via my email rbhinsurance@gmail.com. Your new health plan has two parts. First, there's your primary plan through Blue Cross Blue Shield of Alabama. And now you have a new GAP plan, or secondary insurance plan, that will pay most of your out-of-pocket for major medical expenses. It's important to know how this plan works to be sure it's working for you just as it should. I think you will agree this is an amazing plan, but only if you know exactly how to use it properly. So let's go over the timeline. Step 1, give your healthcare provider both of your new insurance cards, Blue Cross of Alabama and your GAP plan card. Step 2, your healthcare provider files the claim with Blue Cross of Alabama. Step 3, Blue Cross processes the claim. This will generate an EOB, or explanation of benefits. With the traditional plan, this is normally where the healthcare provider would send you a bill. However, with this program, they will now file that EOB along with the original claim to your GAP plan. In turn, your GAP plan pays your healthcare providers directly until your funds have been exhausted. So for most of you, this will eliminate out-of-pocket for major medical claims. So let's take a look at the details. First of all, you will notice the GAP plan does not pay a benefit for your prescriptions. We'll talk more about that later in this presentation. Your GAP plan coverage is going to give you a total of a $9,000 potential benefit. It will pay $6,000 towards inpatient hospital stays, and it will pay $3,000 towards your outpatient major medical expenses. It's also going to pay $20 towards your first 8 office visits during the year. Your health plan has a $40 or $65 copayment for office visits, but the GAP plan is going to turn those into $20 and $45. The section in yellow represents outpatient major medical expenses. This is going to be for things like lab work, outpatient surgery, MRIs, ambulance rides, and emergency rooms. Please know your GAP plan is going to pay the first $3,000 in these types of expenses for you. You will note this health plan has a $2,600 deductible, but when you have a GAP plan with a $3,000 benefit, you have all the money in that account and then some to pay that deductible. The section in purple represents your inpatient hospital benefits. You will note your $2,600 deductible applies, then you would be responsible for $390 for days 1 through 5. However, your GAP plan is going to give you $6,000 towards those expenses. That means your GAP plan is going to pay all of the out-of-pocket associated with a hospital stay, no matter how long your stay. Hopefully by now you are realizing the value of this special program. It is literally designed to pay your first dollar out-of-pocket cost for major medical expenses, and most of you will not exceed this benefit. For the very few of you that manage to exceed those GAP plan benefits, you are well ahead of the game of any previous health plan that you may have had. I mentioned we would come back to your pharmacy benefits, so let's take a look at that now. Most of the medications you'll be prescribed will fall into the no more than $15 category. However, this health plan has a no more than $25 copayment for Tier 2 drugs, a no more than $65 copayment for Tier 3, no more than $100 for Tier 4, and preferred specialty is $250. Probably the most important thing I can tell you today in this video is to pay attention to your cost when it comes to prescriptions. What I mean by that is if you are prescribed a medication that costs more than $25, there is very likely a way to get that exact same prescription from the exact same pharmacy for a much lower cost. Most every brand name drug that does not have a generic available for it yet has a copay card or savings card available from the pharmaceutical manufacturer to get your costs down. There are several good consumer resources to find out more, such as GoodRx.com, BlinkHealth.com, and NeedyMeds.com. So the message here is clear. If you are taking a medication that costs more than $15, there is probably a copay card or discount card made available from the pharmaceutical manufacturer. They are easy to locate and easy to use. Just Google the name of the medication followed by copay card or savings card. This can save you a lot of money. I mentioned earlier, this is an amazing health plan that gives you first dollar coverage for major medical, but you do have to monitor it to make sure it's working for you properly. So let's talk about what to watch out for. Number one, be sure to give both of your insurance cards to your healthcare providers every time you use it. Number two, it sounds simple. Just open your mail to monitor your claims process. You will get a paper trail showing exactly how your claims have paid. If you happen to get an unexpected invoice for a balance due, take note if it's been filed with your GAP plan. Just about the only thing that could go wrong would be your healthcare provider could neglect to file the claim for you. They don't mind filing the claim because it is an efficient and fast way for them to be reimbursed. So simply call the number on that invoice, have your GAP plan card handy, and give them that information so they can file the claim. If you have had several claims or a large claim, it's possible that you've exhausted your GAP plan benefit. You can always call the 800 number on your card to confirm benefits and to see if your GAP plan has paid a claim, and check your available balance. If you're still having problems, you can always reach out to me and I'm glad to help. I care about making sure this health plan works as best as possible for you. If you ever have any questions or problems, feel free to reach out to me directly at 205-222-9440. You can email me anytime at rbhinsurance@gmail.com.